Hey everybody, welcome back to my channel. It's your girl Valerie-Ann. I wanted to make this video today. I've been hearing some disturbing things in the news regarding nursing. So I wanted to make this video today so that I can just, speak about something that's going on that some of you may or may not know. Maybe don't even care, but I believe it's something that should be spoken about, especially as a nurse myself. So what I wanted to speak to you about is that there is a pending strike. There are over 15,000 nurses that will possibly go on strike as of September the 13th. Now, today is actually the 8th of September. So in 5 days, okay, across 6 hospitals in the state of Minnesota. This is bad, okay? This is bad, okay? We need nurses in the hospitals, okay? Everyone knows, you may or may not know, that you cannot run a hospital, whether it's in Minnesota, South Dakota, or Africa. You cannot run a hospital without nurses. You need nurses in the hospital to help take care of the patients, okay? The nurses do the majority of the work. So here's how it goes. The doctor comes in, the doctor sees the patient, the doctor writes orders for that patient, writes out a plan of care for that patient, and the nurse carries out the order, okay, whatever that order may be. Give this medication, give that medication, do this, do that. The nurses carry out the order. The nurses is the second eye for the doctor looking after that patient. When that patient starts to go bad, if that patient does go bad, meaning that the patient starts to get more sick, then the nurse is responsible for doing what he or she needs to do at that time and to contact the doctor to let them know that this is what's going on with the patient. Okay, so you cannot run a hospital without nurses. You cannot run many clinics without nurses. You cannot run many healthcare facilities without nurses. Okay, you need nurses. So my concern is, how is the state of Minnesota allowing this to happen to their hospitals, to their patients, to their nurses? Okay, nurses are tired. Nurses are burnt out. When it was 2020, the year 2020, okay, we know it was the pandemic. Okay, it was the year of the nurse. Okay, because nurses really rolled up their sleeves and they did what they had to do to help the patients that were catching COVID, who were dying. Even some nurses died during the COVID pandemic. Okay, and like I said, it was the year of the nurse. So what happened after that? What happened before that? Nurses have been taking care of patients for years and will take care of patients for years. And each and every one of us becomes a patient at some point in our life. And you know that there's always a nurse around to help take care of you. There's always a nurse around to help do what needs to be done when you're in the hospital, when you go to the clinic or anything like that. So I don't understand how this is happening. So what the state of Minnesota has a union. Okay, and when you have a union, it's a little bit easier to strike because you are able to negotiate your salaries and your thing, whatever the nurses are looking for. Okay, relief from being burnt out. They discuss that through the union. Union's supposed to represent them and negotiate with management. Okay, so right now the union and management are not seeing eye to eye, and the nurses are not having it. So the nurses, effective, like I said, September the 12th or the 13th, one of those days, for 3 days, the nurses are expected to go on strike. Over 15,000 nurses, over 6 hospitals in the state of Minnesota. Like I said, this is big, guys. So what the nurses are saying, I did write down some notes here, so I'm going to take a look at them. What the nurses are saying is that the patient to staff ratio is unsafe, meaning that if you're working on any type of hospital unit and you normally get 4 patients or 5 patients, now they're getting like 7 patients and 8 patients. So it's spreading the nurses a little bit thin. That means that the nurse doesn't have as much time with each patient as they would normally have if they did not have extra 3 and 4 patients. And it's because nurses are leaving the bedside. Nurses are leaving the bedside, and that's a huge, big deal, because when people get sick, when any one of us gets sick and we have to be hospitalized, we need nurses. We need nurses to carry out doctor's orders. Let me tell you, Doctors are not going to write orders and then carry it out themselves. That's just not happening, okay? The doctor writes the order and the nurse carries it out. The physician assistant writes orders under a doctor and the nurse carries out. The nurse practitioner writes an order if it's not a full practice state under the doctor and the nurse carries out the order. We need nurses. Okay, so the nurses in Minnesota are complaining that they're burnt out because they're getting too many patients. Okay, that the salary does not commiserate with their experience. The salary does not commiserate with the workload that they're getting. And it's not all about, there's a lot of things in the article that I read. So it's not all about money. They're also talking about increased education for the nurses. Having the hospitals pay for education for them to go back to school and get educated, as far as what I read, okay? The staffing crisis. Everyone knows, well, just about everyone knows there is staffing crisis right now, and that's why the travel nursing industry is increasing. Shout out to my travel nurses who go out to many different states, leave their families, leave their children, leave their husbands to go out and care for individuals out of state. And it's not all about the money, trust me, because some people, you can't pay them enough money. You can't even pay nurses enough money for the work that they do. Now, when a pandemic was here and nurses were making $5,000, $10,000 a week, okay, maybe it was worth it. But then again, then you ask yourself, was it worth it? You know, I mean, I don't know. I'm not here to judge. I'm not here to discriminate or anything like that. And just some things that you have to think about, okay? So like I was saying, the staffing crisis, the conditions that were supposed to be temporary that the nurses are talking about in the state of Minnesota in the hospitals have now become the norm. Okay, and we have heard that phrase a lot since COVID. That things that, as far as wearing a mask, has become the norm. So you do see a lot of people that don't wear masks. You do see people that still wear masks. But if you see people wearing masks, you're not looking at them like they're crazy because it has become a part of the norm. So, you know, I just wanted to talk about this strike because this is absurd, okay? And so an executive or a spokesperson of the hospital did say that if the nurses go on strike, they have provisions in place so that the patients will be taken care of and that the hospital can function. And what are they talking about? Like I just said, you cannot run a hospital without nurses. So what are they talking about? What provisions do they have in place that's going to replace over 15,000 nurses while they're on strike? So what happened is in the state of Minnesota, when you are under union, right, and the strike is signed off on to say, okay, this is what we want to do. We're going to have this strike. There has to be a 10-day waiting period. And I'm not sure what the waiting period is. Maybe it's time to give the hospital time to negotiate to say, well, you know, we don't want the strike or whatever the 10-day period is. But anyway, there's a 10-day waiting period. So the strike was already signed off on about 5 or 6, 7 days ago. So on the 13th, as I said, is when the nurses are supposed to strike. So the hospital executive said that they have things in place so when the nurses go on strike, that the hospital will continue to function. What do they have in place? Because I have not read that. Okay. Maybe they're talking about bringing in travel nurses, but let me tell you, when they bring in travel nurses, their nurses want a certain amount of pay for the work that they're doing. Okay. When they bring in travel nurses, they're going to pay them really well. You know why? Because it's going to be considered a crisis. It is going to be considered a crisis when you have 15,000 nurses on strike and you have to bring in other nurses from other states all over the world to work. It is considered as a crisis. So they are going to pay those nurses. Okay? So then you think, why not just pay your staff? But I know there's a lot of logistic that goes into why companies don't want to pay their staff as much as they pay travel nurses. And I'm not going to get into that on this video. I will maybe one day make a video about that, maybe not. But there's a lot of logistics behind it. But I'm going to tell you, Nurses deserve the pay that they're asking for. That's all I can say. One of the representatives of the hospital said that it says the hospital executive stated the wage increase request was unrealistic. Unrealistic? How much is the nurse asking for? Unrealistic? It's unrealistic of the monies that's going to be paid out when these nurses go on strike. That's what's going to be unrealistic. Okay? So I'm just appalled by this. Is it just the times that we're living in? And then there's another big hospital in Atlanta that's about to close. I'm not going to go into that because that's another whole story. Another whole hospital in Atlanta about to close. Okay? People. Nurses are a very important aspect of healthcare. That's all I'm saying. And not because I'm a nurse. Yes, I do have a bias, but it is what it is. Nurses are a very important aspect of the healthcare system. You cannot run a healthcare system without nurses, okay? They even passed a new law in North Carolina regarding nurses. I don't know if you heard about this, but they passed a new law in North Carolina a couple of days ago that I'll let you read about that because that one really got me. Even though I can understand why they did that because most states, that's the way they operate, and nurses are very highly educated. Okay, depending on the level of nursing that you have, even licensed practical nurses are highly educated because of the fact that you have to go through a whole year program, sometimes a year and a half. And it's not no joke, okay? It's a rigorous program because I went through it myself. I worked as an LPN for 10 years. It's a rigorous program that you go through. So don't let LPN fool you. LPNs are knowledgeable, okay? And then you just go a little bit further to get your RN. You go associates, bachelor's, master's, DNP. That's the highest you can go as a nurse. But nurses are highly educated. And nurses, we learn things that we're supposed to learn in order to take care of patients. We learn a lot more when we get out on the unit, okay? But let me tell you, the education is worth every dime to become a nurse. And when you become a nurse, it's an essential position. Okay, it's an essential position. When COVID hit and nobody was allowed out, everything was shut down. You know who was allowed to be out on the roads traveling? Nurses. Nurses were allowed to be out on the road traveling. Why? Because their positions are essential. So it should not have to be where nurses have to fight to get the pay that they feel they deserve. They should, it shouldn't. 2020, the year of the nurse. What happened? We're still in a pandemic. It has calmed down some. The numbers is not as, outrageous as they were. But let me tell you, we still get COVID patients in the hospital that we're taking care of. I just worked in a hospital 3-4 months ago, and we had a whole floor full of COVID patients. So the pandemic, we're still in a pandemic. So what happened to the year of the nurse? How come nurses are not being appreciated like they ought to be? And these big executives know that you cannot run a hospital without a nurse, without nurses, period. Bottom line, it's not happening. So the executive says that they have provisions in place in case the nurses go on strike. What provisions do you have in place? Only provisions that you can have in place is to bring in other nurses. It's to bring in other nurses because, like I said, you cannot run a hospital without nurses. That's just the bottom line. So I just wanted to talk about that. I don't know. They may come to an agreement before September the 13th. And hopefully they do because it's really, saddened that the nurses have to really go to this extent because you do have a lot of nurses leaving the bedside. Let me tell you, there's so many things that you can do as a nurse outside of patient care. So many things. And then that's one of the awesome things about the field of nursing. There's so many different things that you can do. outside of bedside nursing. It has a lot of possibilities. So those of you who are interested in going to nursing school, just know it's a lot of work, but it is definitely worth it. Okay, it is definitely worth it. And it's expensive. Nursing school is expensive. Okay, whether you go to licensed practical nursing school or registered nursing school, it's expensive. Okay, so get ready. Get ready. Roll up your sleeves and get ready to do some work. But when you come out, you understand, it's going to pay off. It's going to pay off. But let me tell you, you have to want to do nursing from the heart. Nursing is not a job that you just go into and this is something I want to do because I want to make some money. Because as you can see, we don't get paid as much money as we should, or as much money as we could, because a lot of nurses love working at the bedside and taking care of patients. And sometimes that's not where the money is all the time. But a lot of nurses love doing it. I love working at the bedside. I just don't like being burned out. I just don't like being stressed. I just don't like being overwhelmed. So every once in a while, yes, I will pick up a shift in a hospital just to do that bedside nursing, just to take care of people. It makes you feel like, yes, I am a nurse, okay? When you're working at the bedside and you're helping others in their most vulnerable state of time. So I just wanted to talk about that. I just wanted to come on here and talk about this strike that I'm hoping that doesn't happen, because who suffers the most? The patients. The patients suffer the most when things like this happen. And like I said, at some point in time, we're all patients in our lives. So, I'm just hoping that they get something together to, negotiate. Apparently, the negotiation is not that great right now because the nurses want to go on strike. I mean, and that's what it is. The nurses want to show them that you cannot operate this hospital without us. So why not let us come to an agreement? We're showing up to work every day. We're leaving our families every day. We're coming home. We're still working with COVID patients, a possibility that we can bring COVID back to our families. So at least compensate us for it. At least compensate the nurses for it. And that's what they're asking. Let me see. A spokesperson talked about, yes, they have things in place, and I tell you, this was really something when I read it. TheGuardian.com says that throughout the COVID pandemic, many nurses have moved away from the bedside due to being overwhelmed by working challenges like understaffing, which has a direct effect on patient safety. And that is 100% true. If you have 8 patients instead of 4, you're rushing, you're tired, okay? You may not, we're human guys, okay? You may not be as diligent as you would if you were not tired. We're human. So that's why they have a lot of safety checks in the healthcare system for nurses, so that we don't make the mistake. We are the last person to check before any medication is given to a patient. It goes through from the doctor writes it, it goes to the pharmacy, whatever checks they have, it comes to the floor, goes to the pharmacy tech, then it goes to the nurse. We are the last person to make sure that whatever that patient is getting is correct. And not just on the bottle, just making sure that the doctor has written it correctly, because let me tell you, and that's all I'm going to say about that. So nurses are very beneficial, guys. I'm sure a lot of us already know that. Nurses are very beneficial to the healthcare system. So, and then Guardian.com says that if this strike takes effect, okay, this will be the largest strike in history. Over 15,000 nurses. That's a lot of people. That's a lot of nurses that will be walking off the job and striking just for something that could be negotiated. Because what's going to happen, eventually you're going to negotiate it anyway. So don't let your nurses walk off the job. It's going to be negotiated anyway. Because like I said, and I'll say it, and I'll say it, and I say it, you cannot operate a healthcare system without nurses. And like I said, yes, I do have a bias because I am a nurse, but this is fact. This is fact. You cannot operate a hospital without nurses. You cannot operate majority of clinics. You cannot operate majority of anything that pertains to healthcare without nurses. Shout out to my medical assistants, okay, because they're a big part of the healthcare system as well. Shout out to my medical assistants. Shout out to all my healthcare people out there that's making things happen, that's helping to take care of patients. We need healthcare workers, guys. We need healthcare workers, especially our nurses. So I just want to come on here for a minute and talk about that. And I hope that all is going well with you guys. I am still working on my business. It's going well. I'm really seeing it come through. I will be putting up a video about that shortly. It's a lot to do. It is definitely a lot to do. So I'm just making sure I'm crossing all my T's and dotting my I's. Like I said, nursing. I'll be working with clients or patients, however you want to call them. I want to make sure that I have things in place that everybody's going to be kept safe. So thanks. I mean, I really appreciate the comments and everything like that. So guys, let me know what you think about this. I mean, put it down in the comments. What you thinking about over 15,000 nurses about to go on strike because they feel like they're being overworked, they're overwhelmed, they're understaffed, they're underpaid. What do you think about this? What do you think about what's going on? Is it just the times we're living in, or is it just that nurses are just really not being appreciated? Give me a thumbs up. Give me a likes. Let me know what you think about this video. I really wanted to come up here and just express this because I'm just like appalled by this. And, it's a big thing. It's a really, really big thing. A lot of times we don't hear about things like this because it's in another state. And, sometimes it doesn't affect us. But as a whole, it affects us. Trust me when I tell you. So put in the comments what you think about this whole situation with the nurses in Minnesota going on strike. And plus a big old hospital in Atlanta will be closing soon. So that's another whole story, another whole video. I'm just like, oh my goodness. All right, guys. So y'all have a good evening. I thank you. I'll speak to you soon.